morning, everybody. I'd like to welcome you to our session today on engaging consumers too early to build genuine partnerships. Before we begin, I want to acknowledge the traditional owners of the lands that I'm dialing in from today, the Turrbal and the Yuggera peoples in Meanjin, Brisbane, and all traditional owners of country across Australia and any First Nations people joining us on the call today. I pay my respects to their ancestors and their descendants who continue cultural and spiritual connections to country. And I recognise that these have always been places of teaching, learning, research and collaboration. I'm thrilled to welcome our panel today, Professor James St. John and Dr. Kelsey Chapman from Griffith University, Dr. Zephanie Tyack from QUT, and Dr. Lisa Animet from Metro North and the University of Queensland. In today's session, we will have presentations from our panel members, followed by a Q&A session. So I'd encourage you to please use the Q&A function during the webinar so that you can ask any questions that you have. And in case you need to leave early, we will also have a recording of today's session available online, together with a copy of the slide decks on the HTQ website later next week. So I'll hand you over to Kelsey to kick off today's webinar.
Hello, everyone. Thank you for joining the session. I can share my slide. And can you see that? Yes.
We can.
Okay,
Thanks,
great.
James.
All right. So thanks. Thanks, everyone. I'm the head of the Clem Jones Centre for Neurobiology and Stem Cell Research at Griffith University. I lead a team of over 40 researchers, and we work on different things: spinal cord injury, peripheral nerve injury, and also Alzheimer's disease. But our main project is spinal cord injury. And since the commencement of the centre in 2016, I've brought in over $40 million of research funding for the research and clinical trial. In August this year, we launched our clinical trial, which is olfactory ensheathing cell nerve bridge transplantation, a co-designed clinical trial. And this has been 9 years in the making. And throughout this whole process, we've had very strong consumer engagement and involvement. And this year, I was awarded the National Health and Medical Research Council Consumer Involvement Award in recognition of the co-design of the trial. So hopefully what I'm going to show you today gives you some insights into what we have done, and maybe you can use some of these ideas for your own work. So this is the launch of the trial. It's a cell transplantation trial. Spinal cord injury is devastating because there's no current treatments available, and cell transplantation offers a biological repair that can restore potentially motor, sensory, and autonomic function. As I said, we launched this in August, and it's been an incredible community involvement, and we are very proud that this has been co-designed by the community here in Queensland, but also throughout Australia. We have partners in Sydney, Melbourne, and Adelaide. Key points for the trial are that it's cost over $15 million just for the clinical trial itself. So you can imagine it's a huge effort to raise that sort of funding. And 1/3 of that funding has come from philanthropic donations. That was a critical to our success. Without the initial philanthropic money, we couldn't have got the Queensland government support nor the Medical Research Future Fund support. So having designers in the start, putting money into the project itself helps us secure the government funding. The trial has been co-designed by consumers, and I'll go through that. And we've had a lot of interaction with the community. When we launched the trial, the community knew that we were about to launch it. They were waiting for it. And within 3 weeks of opening up expressions of interest, over 500 people had applied. And that represents, in the total population of spinal cord injury community in Australia, which is in excess of 20,000 people, that's 2.5% of the spinal cord injury population. But in fact, just in our catchment area of Eastern Australia, that's 5% of the spinal cord injury population. So it's a very high interest in our trial. And we're very pleased that our community engagement has led to that success. Oops. Oh, sorry, I'm pushing the wrong button. One of the keys to our success is lab tours. We have people coming through our lab 2 to 3 times a month, sometimes more than that even. And while you can and think it takes time, it's extremely valuable. It's really good because we get to talk to the community and they get to talk to us. And particularly for our research team, they're getting questions from the people living with the conditions, their family and friends and carers. And you know, having that outreach and constant engagement really makes us focus on delivering a therapy that suits them, but also drives our research team to, to work harder and more enthusiastically because they know there's people out there who are really keen for us to be successful. We've had politicians, of course. You need to involve all levels of government. We've had local, state, and federal politicians come through, and state bureaucrats as well, who've been critical in advising us about strategies for funding and that sort of thing as well. So as I said, we have about 2 to 3 people per month, and over the last few years, we've had over 1,000 people through. And these lab tours have directly led to some incredible donations, very large donations from individuals. We treat everyone the same. It could be a mum and dad whose son or daughter has just got spinal cord injury and they're looking for information, or it could be a wealthy donor who's looking for a project to support. But most importantly, it's the questions. We were always impressed by the questions that we get from people who aren't scientists, but they really give us questions that make us think about our design of the trial and our research to see if it's suitable for them. And we have changed many of our approaches because of these questions that we as researchers can't think of, but the people with lived experience can think of. Another critical aspect is our consumer panel. So in 2017, we established our Spinal Injury Project Consumer Panel. Again, with good community engagement, we had 120 people apply to be on this panel within 2 weeks, and we selected 7 people from around Australia. They are the voice for the community. They have their own networks, and they listen to those networks. We meet once a month. They are paid for their time. They also review our research grants, grant applications and advertising that we use, and they are co-investigators on grants, and they are co-investigators on our successful Medical Research Future Fund grant that funds a lot of the clinical trial. We've also done online surveys of the community, and we've had over 180 people for this particular one survey we did. But it was really important for us to understand the differences in attitudes, plus also importantly, the differences between males and females in this particular survey, where we can see that females were less likely to be wanting a donor cell transplantation, for example. So that again allows us to think about, well, if you want to target women in the trial, we need to be thinking about the type of cell transplantation that we are using. And again, you can see here from this one, which is the type of surgery that is used, open surgery. Men are more likely to be happy with that, whereas women are less likely to want that sort of surgery. So again, it allows us to plan into the future to have a minimally invasive surgery to make it more accessible for people who might be more hesitant about having open surgery. And then another thing we looked at is also advertising. Unfortunately, there's a history of advertising in biomedical research in which the icons or the figures used in advertising are often generic or masculine, and there's good evidence that says that many women don't apply because they feel that the trial isn't designed for them because they can't relate to the icons in the trial. And also when we think that 20% of people with spinal cord injury are female, 80% are males for lots of different reasons, we need to be encouraging women to apply because we need more women in our trial. So we got similar numbers for our comparison purposes. And so we, realizing that there's a lot of men out there who want to apply, we used our advertising and we made our icons in the figures in the advertising deliberately to be feminine, so that we can hopefully a message is to women out there, please apply for our trial because we desperately need you on the trial if we're going to reach our target of at least 40% women. And we've had fantastic support from the community. As I said, 1/3 of our funding is from philanthropy. We've got state government and federal government, and that's because we have a very broad reach across the whole of Australia and also now New Zealand and internationally to support this trial. So it's been, in my job, yeah, it's a lot of clinical trial management, a lot of research, but the most exciting bit is engaging with the community. I get such enjoyment from talking to people about what we're doing and getting their feedback, and to have that sort of relationship with the community is absolutely fantastic. So that's my presentation, and I'm happy to take a couple of questions before we move on to the next speakers.
Thanks, James. It's just Kelsey here. There's 2 questions for you in the chat, which I think we probably have time for. The first is from Katya, who said, can you provide us with an example of how a consumer perspective has impacted how you conducted research? How has it made you think differently?
That's a great question. In our trial, we have had to include a control group that doesn't have our cell transplantation, but they do our intensive long-term rehab. And we've had to really struggle with that ethically, and we consulted with the community. And some people said, oh, I'll be really disappointed if I was put into the control group because it's randomized. But other people in the community says, well, we know there has to be a control group. And for the benefit of the greater population, we are happy to be participants in the control group, and we get free rehab as well. So that allowed us to be confident that at least some people are happy to be part of the control group, even though they might be disappointed not to have the cell transplantation.
Interesting. We've got one more question from Joe, who asks, I understand the need to appropriately compensate consumers for their time and know that this is a permissible cost on grant budgets. However, how do you establish a consumer group ethically and effectively when starting on a new research theme for which large funding to compensate for time is not yet available?
Yeah, that's a great question. When we first started our consumer panel, we didn't pay them. And then when we said, oh, well, with the new guidelines coming in, we said we want to pay them. They said, we don't want to be paid. We're doing this for our benefit, for everyone's benefit. They really didn't want to be paid. But I said, we insist. So there are consumers out there who just are doing it for the greater good, which is fantastic. So you can ethically do that as long as there's good communication as to why. I think that's right.
Great, thank you, James. And I think we'll now hand over to Associate Professor Zephanie Tyack, who's going to run through her presentation. Zephanie is a health services researcher and implementation scientist at the Australian Institute of Health Services Research at QUT. So Zephanie, I will hand over to you to start sharing.
That's it. Great.
Wonderful. Thank you. Similar to James, I really wanted to focus in on learning by doing, and I guess that's what my experience is by actually having a go at engaging consumers early. It's really shaped the way that I've done projects, and it really has shaped the outcome of them. So just to share a little bit about me, I'm an implementation scientist and also an occupational therapist. And I lead a team at the Australian Centre for Health Services Innovation. So we really focus in on that translational aspect of research. And I'm involved in really small scale as well as some really large scale projects. And a lot of the consumer work that I do really does start at that small end of things. And usually that is well before we're going to start implementing anything. And I'll just share a couple of projects with you where we really, that beginning point, that early engagement has really changed a lot of the different aspects of our project. And just a little bit of background, I also have a special interest in youth and paediatrics and use a method called community engaged research a lot, which is where it's a real partnership between a researcher and community members or consumers. So just in terms of, learning by doing, something that I really focus in on is looking at the before, during and after. So really being mindful of what you can do before you actually get to start the main part of a project. And sometimes what we've learned along the way is that that can be really informal connection at times, and other times much more formal. So one of the projects that I'm leading is called the Bridging Study, and that's a project where we're looking at care navigation for mental health in rural and remote areas. And part of that project was to set up 3 new sites as well as evaluate an existing site. And what we really, what we've learned from that is that at times we really had to adapt the methods to really connect with community. So for some of sometimes what we ended up doing is we got a local community member to open up a cafe, and where we could really connect with community more informally, and that really met the needs of that community. And in another community, we really had something much larger where people could sort of register to come along on the day, and we held a town hall. And we also did some co-design work. So it was really critical that we started the project before we got the grant funding. We did some co-design. And what we learned was that the outcomes, co-designing the outcomes with community were really important. And really the primary focus that they suggested we focus on was really being able to sustain access to that new mental health service, which was all about connecting people with the services that they needed. So we ended up using an outcome which we called sustained access, which was really about that access to services and being able to sustain that in the long term. And then I'm also leading another project which is looking at developing resources and support processes for burn survivors. And this is called the Embed to Empower project, and that's funded by MRFF. And in that project, really, we have 3 different phases. The first phase is really about exploring what is needed. So again, all about that, looking at things before we actually get to implement anything. And we've got 2 consumers who are chief investigators on that project, and they're going to be involved in almost every part of that project. So in terms of my tips for relationship building, managing expectations, and also compensation, I would say don't forget the simple things, things like checking in with people, consumers and community members, to see what they like, what works for them. Don't assume that what works for you might work for them. And I keep reminding myself, and we try to work very hard in my team to really be flexible. So, running workshops in the evenings, we've just done that in the last week, the last couple of weeks, running a workshop from sort of 5 to 8 of an evening when it suited most of the consumers. In the past, I've worked up grant applications with consumers, and we connected during the weekend, because that was the time that most of them could give up their time. And I think it's really important to remember that they are busy people as well. And so don't assume that they're going to have lots of flexible time. And also checking in, I think, and connecting. Some of the most simple things are the most effective. So when we go to our sites in rural Queensland for the bridging study, we often just say, oh, we're going to be up there. Would you like to catch up and have a coffee? And so we have a meeting like that, and that's lovely because we get to know our consumers as people. In terms of barriers, I'm not going to talk through all of these, but I think providing a safe, sensitive environment, I think that's really important. And there's lots of ways that we've learnt over time that we can do that. Sometimes it's as simple as really just making a person feel comfortable and welcome in a meeting, connecting with using simple things, just sharing something that you've got in common, and setting up when you're doing workshops and big meetings, just making sure your consumers have their own time and space that they can give their input. And also, I think making sure that you have a debriefing session. So we at all the meetings that we have with consumers, we always have that debriefing before as well as afterwards. In terms of the things that enable, I chair a consumer group that actually directs our research centre. So they provide high-level oversight of some of our research activities and how we can embed consumers. And I think something that's been hugely valuable is having high-level support. So through that group, we have about 10 members on that work group, and our high-level leaders have provided additional support. So that's grant support and funding that can really get projects kick-started early on. So they give a little bit of funding to really help to shape projects that might then go on to be bigger projects or for grant applications. So yeah, I just leave you with a thought, really encourage people to think about embedding consumers early, because it can change the whole way you do things, and it really can end up where you can really end up with very meaningful outcomes in the end. And I think research that is actually much more valuable to the communities that you're interacting with and that you're studying. So thanks very much.
Thanks, Zephanie. There's just one question in the chat for you that asks from Taryn, what resources did you utilize to know how to go about effective and ethical consumer engagement? And then the second part of the question is, how did you start or realize this was important for you?
Yeah, so that's a great question. And actually we've been our sort of research implementation group, some of us have been working through this some more. I think each time you connect with consumers, I think it's that sort of continual improvement. So I don't ever say that we get it exactly right, but we're trying to continually improve. So we've actually embedded like a trauma-informed approach to some of our consumer work, and we've actually had an external consultant come in recently to do some more upskilling and just to help us think through some of the things we can embed. But there's also some great publications on this, and so we've drawn on a lot of those recently to sort of come up with our own principles, and a lot of them are along the lines of making sure you really think about what you can't ever guarantee safety. So you try to weigh up that safety side of things versus never taking away the opportunity from someone to participate. But you're just putting some of you're raising awareness of some of the support processes that you can have, and making sure researchers are aware of what support they may need to offer. Should a consumer be having a really bad day, or just being able to check in, afterwards to make sure, just asking, are you okay? Is there anything we can do to support you? So just checking in, I think, goes a long way.
Thank you, Zephanie, for that. I can see that there's lots of questions in the Q&A, and a lot of them are things I think we want to discuss as a whole group. So I see them in there. Thank you for popping them in. We are going to move on to our next presentation, which is Dr. Lisa and Matt, who's a speech pathologist and conjoint research fellow with Metro North Health and the University of Queensland. Lisa.
Thank you, Kathy. Can you see that? Okay. So, a lot of people that I talk to don't really understand what a conjoint research fellow is. So for everyone who doesn't understand, I thought I'd just quickly explain what that means. It simply means that both the health service and the university co-fund the role. They both see the value in it, and we look for joint outcomes to benefit the health service that employs me, as well as the university. So that's just simply what a conjoint research fellow is. This research, conjoint research role is a little bit different to traditional research conjoint fellow roles in that it's dedicated to consumer and community involvement, which means I work across lots of different disciplines. I am a speech pathologist, but before I re-upskilled as a speech pathologist, I was a nurse and practiced across a number of different hospitals in Southeast Queensland. So I've just added a little tiny bit about me here and some of the different areas that I work in. Additionally, I thought it might just be helpful to give some examples of some of the different ways or different types of involvement we've had with consumers. So we've supported consumers to deliver keynote presentations about our research. We've co-authored multiple publications with consumers now. That probably needs updating. We've supported consumers to present with us or independently. And we've worked with consumers on redesigning policies and procedures here within our health service. In terms of some of the different types or the scope of involvement, here within the STARS Education and Research Alliance, we have consumers embedded within the health service on the STARS Research Committee. We have consumers who are involved as part of our grant review process to decide on which funding will be awarded to different projects. We involve consumers in a lot of our co-design work, clearly. We have them as co-investigators on multiple different quality improvement as well as research projects. And we have involved consumers across multiple different ways. So there's lots of different things, whether the research is funded specifically or whether it's a health service activity or even if it's a university-led activity. So I just wanted to demonstrate that there's a really broad scope and broad brush when we're talking about involving consumers and how important the relationships are to really strengthening how you partner together and how all of those activities can really lead to strong partnerships in individual research projects for the good quality outcomes that you've already heard Stephanie and James talk about. Sorry, John. And the reason I wanted to talk about this example is that when you're thinking about a co-design project, for this one, we really had to think about accessibility in terms of people who have communication disorders. So understanding or communicating how could we meaningfully involve a person with a communication disorder specifically meaningfully within co-design processes. And so for this research, what we had to do was significantly modify the process, and our consumer advisory group that we had embedded throughout this research really informed every stage of this research and made it meaningful for the people who were involved, and it's what helped us really get some valuable outputs. So I don't expect you to be able to read this, but I just wanted to show you, this is an example. We really made an intentional effort to have consumers contribute to designing every element of the research that we did, from the design of the questions and how the questions would be asked, the process of how we would contact and interact with all of the people who participated in the research, all of the different ways we connected with each person who contributed. So we have some learnings from that. So this is one example I wanted to highlight. And then the second example is work that was funded by the Royal Brisbane and Women's Hospital Foundation. And for this research, what we really wanted to do was understand a baseline of where consumers had been currently contributing in terms of research partnerships across all of the different stages of the research cycle and across different research areas. So we had researchers and consumers who had partnered in basic science, in clinical science, health services science, and public health research. And we had multiple different methodological approaches represented. And so we asked consumers things like what worked well. We also asked the same questions of researchers. We asked them what support they had access to. We asked them around things that could be improved. But one of the things we really wanted to understand was things like, we know that there's training needs that people have, but we also know that there's organisational challenges within the format, within the organisation that you sit within, that can be a barrier or enabler to how you want to outwork the consumer and community involvement that you have within your research. And for example, if I can provide training on how to reimburse a consumer in an appropriate way. However, if the organisation that you work for can only support you to provide that remuneration in a certain way, the training isn't the only answer. There's also challenges within the organisation that might need to be addressed to support you to be able to complete that engagement activity in the way that you would like to complete it. So I just wanted to talk through some of this research and we'll mention it before we get into the key learnings that we have around how to meaningfully engage early. In terms of this research, we came up with 6 top priorities, and these were the top priorities that we had that came out of this collaboration process. And it was really interesting that the top priority in this research was that we needed dedicated consumer support expertise to provide logistic and resource support for both. Well, this one says for researchers, but within the research itself, consumers were also really found that they had better experiences where that support was available. And some of the reasons around that is that where that support exists, the researchers do have more time to connect meaningfully with the researcher. So in terms of the top tips or the things that we learned that we can draw from those experiences, things to think about when you're building relationships are, like we've already heard from everyone who has spoken before me, start early. So before you have the idea, thinking relationship is the goal more than the research output. When you build those relationships with consumers and you discuss an idea, this is where these really strong and rich ideas come from. And then we can design projects together right from the start. Thinking about what is the best fit in terms of consumer engagement for the research project and for the consumer. Thinking about the types and the level of support for the consumers and the research team that might be available. And things like when you're partnering with consumers, have you covered some elements of diversity? Have you considered the different cultural backgrounds that might weigh in within the area that you're researching? And have you considered social disadvantage and how those people might be supported to contribute? And definitely touched on this a little bit with thinking about different ways to engage, like engaging outside of hours. So people who need to work can engage in the evening if they would like to. Things around managing expectations, which is another area that comes up quite a bit. Thinking about what is the best fit for your project and for your consumer partner, agreeing on the terms of reference. And this seems like quite a formal structure or process to go about. But when consumers are involved in different research projects, maybe with you, maybe with another researcher who comes from a different organisation or institution, expectations can be different. So if they're being involved with a different research project in a different way, then their expectation, if you haven't had this discussion, might be that you'll engage in the same way. It's all research. So if it's really helpful to have those open and frank conversations in the beginning around where and how you're going to support the consumers to partner on the research that you're embarking on together. Another area that often comes up is discussing what the communication style or support needs might be, the support needs that they might have associated with the disorder that they're drawing on their lived experience from, what type and amount or activities are being remunerated, or what types of reimbursement they have access to for the research that you're going to engage in. Don't wait for the consumer to ask you. Make sure you have these frank conversations up front. And in terms of barriers and enablers, time often comes up. I think we often underestimate how much time goes into building relationships and all of the infrastructure around research. And it's not different for engaging with consumers and partnering well. Thinking about the funding and really finding, often I have conversations with people and they fund the activity itself but forget to add in the additional funding for all of those conversations around the research. So those pre and post check-ins with consumers, you know, the conversations you have to build the relationship and those sorts of things. Thinking through accessibility, this can be a really big barrier if you are partnering and it's on a health service location, and it requires different consumers to have vaccinations before they attend. This can be a significant barrier to a number of consumers. So really thinking through the challenges that might exist and where you might be able to meet to make sure the location is accessible for everyone who is engaging. And that access to expertise that you can draw on. And there's lots and lots of different groups and individuals in the community who have expertise that you can find out from, including both Zephanie and James who've already spoken. And that's everything I wanted to really highlight. Thank you.
Thank you, Lisa. There are lots of questions coming through. I might just ask you one question, which is how can we effectively involve consumers in research activities such as grant review when they may not have that prior research experience?
Well, that's a really, really good question. Often grants have sections where they talk through different elements of the partnership, and what we often have with consumers is they'll look at the consumer involvement elements of a grant and they'll say, this looks really meaningful. I think I can really see the evidence of where they have consulted with a consumer. They've thought about remuneration activities. They've talked about how they're funding support for the consumer. They've really talked through access. They've talked about how the community have really informed this idea or this decision, and they've looked at different ways to disseminate the information. And so they provide an informed decision around that CCI engagement. Like I think everyone who reviews a grant, you know, a statistician might bring in that really, you know, they're going to really analyze and bring their expertise to those elements of a grant. You know, the qualitative researcher is going to look at the qualitative elements and really, you know, really focus, draw on their expertise for that. And consumers draw on their expertise as well from their experiences.
Great. Thanks, Lisa. Fantastic answer. So that is it for our three presenters. Now we are going to really open up the chat. I can see there's a flurry of activity in the Q&A. And so we'll maybe start off with some soft ones. There's some hard-hitting ones in there too. And so the first question is from Ting, I think it is, who said, can you describe when in the planning process you think about funding the consumer event and kind of engagement meetings and how you might do that? And I think that was firstly directed at James, so we might start with you.
Okay, thanks for the question. When do we start planning? We start planning from the beginning. Doesn't mean that we can actually put it into the grant application because maybe we don't have a grant application coming up. But certainly in our experience, and we started a long time ago before the expectation of paying consumers was, you know, mandatory. But now it's just, yeah, we do it all the time. So I don't know when was the start date when that happened. But certainly it's a conversation, as the other speaker said, it's a conversation with the consumers. So there's clear communication about the expectations of the roles and what's involved and the time that's involved. So it really depends on how much you are involving the consumers as well. If there's a high demand for their involvement, obviously, yeah, that requires clear communication beforehand about that time commitment and then that compensation. But yeah, from our point of view, it's standard for us in grant applications if we're involving consumers.
Thanks, James. Zephanie or Lisa, did either of you want to jump in?
Yeah, I just probably mention, I think now a lot of centres are realising that they need to have the infrastructure there so that can help organisations with their planning. So, for example, our research centre now has these regular grants that come up, and the grants are just pitched at the consumer side of things. They just give you enough funding to engage a group of consumers in a meaningful way to work up a project. So it's very helpful, I think. So we also have like a consumer advisory group, and they're there all the time. So they're already embedded in our research centre, so we can access them. And so this has just happened in the last week. Is someone said, oh, I really want to work up this project. I'm going to need to connect with someone fairly soon. And we said, well, why don't you connect with our consumer group and just see how that goes, and then we can go from there. So I think organisational support can really, really help with a lot of that.
Thanks, Stephanie. That's really interesting. There's a couple of questions with overlapping concepts in the chat, which really speaks to how do we find these consumers, and how can we get in contact with them, particularly when they might not have had prior research experience. What do we do? And this is from cross institution. Do you have any suggestions where people can start, or how people can start, especially those early career researchers? Lisa, did you want to jump in on that?
Yeah, sure, I can jump in. It depends on the topic or the area that you're interested in and the type of lived experience you're hoping to draw from. Some are more diverse and some are really quite specific, where you really want the lived experience of a condition because you want to inform a treatment outcome. Oftentimes there are community groups that you can reach out to. Some consumer advocacy groups will have already connected with researchers. But sometimes institutions will have a network that you can also connect in with, and you can, arrange some times to meet. There's a lot of conferences now who have peer networking events or sessions where consumers are presenting or drawing from, and if you can attend those and make connections during those peer networking events and build some relationships, reach out to other researchers who have established relationships and ask for some advice within those fields. There's lots of different ways I think you can connect. We have a rolling recruitment here within Metro North at our STARS facility, where patients who come through and access our services are given an opportunity to join the network and we can talk through with them potential things that they're interested in and the types of research they'd like to be invited on to engage with.
Thanks, Lisa. Yes, go ahead, James.
Okay. So in our experience, our consumers are also in many ways clinicians as well, because they'll be using our cell product to treat patients. And so we do a lot of involvement of clinicians. We ask clinicians, do they have patients that they can recruit or ask whether they want to be involved in our consumer involvement discussions. Also allied health partners, and as Lisa was saying, certain consumer advocacy groups, they're really important. Pretty much people and social media. I mean, I'm too old, I don't use social media myself, but I know it's very important. And within our team, we have a very strong social media presence. We recently set up a new panel for traumatic brain injury, put out a call for people just in the community who might be interested in joining our panel for traumatic brain injury. And we had 8 people just contact us just through social media. So there's lots of different ways that it can be done. So clinicians, allied health, consumer advocacy, and definitely social media.
Thanks. Yes, go ahead, Stephanie.
Maybe I could just mention also, if people do have a little bit of money, Health Consumers Queensland, so we've found their process really amazing when we do have a little bit of money from a seed grant or from a bigger grant, and they're really amazing at mentoring and really building people's skills in that, with the whole process of recruiting, doing the debriefing, what that should involve. So they're another great resource.
Thanks, Stephanie. Just from my perspective, I suppose I didn't introduce myself. Sorry, I got kicked out of the meeting at the beginning. So I am Kelsey Chapman from Griffith University. I'm an early career research fellow in our Inclusive Futures program. And just to kind of speak to the ECRs out there, because I've recently been in your shoes, like less than 2 years ago, particularly if you're an HDR candidate, this can be really challenging, and your supervisor might have some good consumer relationships that you could leverage, but alternatively you might be looking for new consumers. And this is something that we often discuss in our team. Like, we hear from the same people very regularly who are extremely engaged, but how do we get new voices at the table, particularly people from outside Brisbane or the Gold Coast, where I'm located, and people from multiply marginalized groups. And so one of the best things that we've done is to think about how we can actually add value back to those communities beyond just the research. So we've got a hub, and we send out a monthly newsletter that talks about nothing really to do with our research. It talks about tools and paid opportunities that might be available with us, but with other groups as well. We send out jobs, we send out blogs, plain language research summaries, and try to get really creative about the ways we can add value back to the community before we ask for something from them. And we find that that works really well. We've got a very high open rate for our newsletter, and people are constantly joining. We've had 124 people join just in the last month. And so that creates this really active hive where then we can say, look, we're looking for someone who's outside of a metro center. Some of the other things that I think to consider how to find these people, as Zephanie and Lisa mentioned, are through your kind of not-for-profit and peak body organizations with the Queensland government. They're extremely active, and they have a big pool of people. So someone like Amparo or Outback Independent Living, those are groups that we work with regularly who have consumers on their board or engaged as their staff who are really keen to get involved. Just looking through some of the other questions, we've got about 10 minutes left, so feel free to keep adding them to the chat. The next question is about informed consent. So do you seek informed consent from your consumers? How do you do that? And I guess I'll extend that question to include, what are you doing for your ethics applications? Is your consumer advisory panel included or not included? And how are you structuring that? We'll start with Zephanie, you're on the screen.
Yeah, so this is a really good question, and it's come up for us, and we've been pondering this in our the latest study that I'm setting up. And one consumer advisory group is already set up, so we don't require any ethics for that. And we've decided that we don't need ethics to set up our other consumer advisory group. But if those people did participate in the study, which they can do, then yes, we definitely would need consent. But we do walk people through, and we will, with the new group that gets set up, we walk through much of the same sort of information that you would have on an ethics committee, just to make sure people they feel safe and secure. So a lot of the same principles, I think, apply across both. But we'd be keen to hear what other people on the panel think.
Well, I'm happy to jump in then. So in our situation, the same thing for our advisory group. We don't have ethics for it because they are what we consider as co-researchers in many ways. We're not using their advice for analysis or for any outcome for publications. When we engage consumers for surveys, of course, that's completely different. So because we are using their results for research outcomes, and so they will have informed consent as per regular sort of ethics applications. So it's the same as Zephanie. It's for the advisory ones. We don't have ethics for that.
I'll just echo what the others have said. We do the same. I think one point of difference might be when you are evaluating the consumer's experience of being part of that consumer advisory group. That's a separate piece of ethics. It's all data that they're contributing to. It's not them being part of that research team. And so there's ethics involved in that. The only other point I think that maybe touches on ethics is if you're considering a terms of reference or coming up and signing something where you've got an engagement agreement, which is not ethics. It's just it's thinking about what supports are available, what are you agreeing in terms of the activity you're about to embark on.
Thanks, Lisa. I think it's a good chance now to also plug the recently launched HTQ CCI framework as a good place to kind of look at and guide some of this early activity and thinking through your planning and some of the questions that have been asked in the chat. We've also popped the link. I've done that for the questions, and I think the team has popped a link in the chat to the microgrants as well for people who are asking about that early funding support for this type of work. I want to delve into some of the really practical questions that are in the chat while we still have time. And so one of the questions is about how you steer consumer engagement in co-design. So do you present your proposed protocol? Do you invite people to kind of comment and suggest change? Or do you go in with some sort of pre-prepared question? Or is it a much more kind of open brainstorm conversation? And maybe what are some of the like rigor methods that you put around that? And this question's from Elizabeth. Zephanie, do you want to start us off?
Very happy to jump in. I think it depends somewhat on your methods. So I would use a wide range of methods. Sometimes I'm using a really deep qualitative method, and there might be particular things I've got to think about. So some of those I have, you have a pretty blank canvas. Other methods are much more structured, and so you will go in with some set questions. But often I will leave my methods fairly flexible. So if things are coming through that I think, oh, this is really different to what we were thinking, and actually it happens a fair bit, that really unexpected things come up. And I've had this happen recently where people had been saying to me, clinicians, oh, mental health, I'm pretty sure mental health is going to come up as being the top priority of this group. And as we got to the going through, we were like, actually, no, it hasn't. They've actually said, do not target mental health. And I was like, I can't believe that. That was so different to what everyone has told us. But listening to them, so it's really just, your methods have to you do have to align those with the different techniques that you use in co-design. And I think co-design is a bit misunderstood because there are so many ways of doing that. So it definitely needs a lot of thought, and so to some extent the project will guide what that needs to look like.
Thanks, Stephanie. Lisa, did you want to jump in on this as well?
Sure. I think Stephanie's really touched on it with explaining that co-design is a really, really broad field of research, and there's lots of different ways to approach co-design. I think it depends on the funding, the scope, the type of research that you're doing, the type of methods that you're using within the co-design that you're embarking on. There's co-design examples where consumers contribute as part of the research team, designing how it will be done, and then they might co-facilitate or facilitate elements of the co-design activities that are actually done where you're, making those changes and designing those outputs. And then there's other people who might contribute who are recruited to be the co-designers who are working with you to design outputs. So I think the biggest thing with co-design is that openness to to different ideas, like really maintaining that flexibility and being open to change.
Thanks, Lisa. I might just add into, there's a lot of great frameworks like the HTQ framework. QDN also has a Queenslanders with Disability Network, has a Principles of Co-Design that I can highly recommend as well. And there's also some different frameworks like experience-based co-design, where you can have a look at what people are doing practically and how they might apply that. One of the things that our team is struggling with is, and this gets to another question in the chat, that we often come from really different professional interdisciplinary contexts. So this is quite a health focused presentation, but this type of work is really relevant to our social science research colleagues, or people like me who are sitting across both kind of social science and health research. And you know, how can we combine or translate our different professional experience as we all talk about really similar methods, that buzzword about co-design. And that's something that we're working to address. We struggled to even develop a consistent definition across kind of 10 researchers at Griffith to come up with what co-design actually means. And so I think a great place to start is to ask your consumers what that means. We've got a pretty like maximally open brainstorming process that we like to use. So say like, what are your expectations of this process? What do you think co-design should look like as we walk through this project together? And then you can also address expectations very transparently. So when someone says, I want to be involved in every single step, and that's not feasible for your budget, your timeline, or the project you're working on, you can respond really transparently to that expectation and hope to reframe that. Or someone might decide that that's not the right project for them to engage in. And so that's, I think, the best piece of advice that I can give is that transparency of communication and setting the expectations, both your consumers setting their expectations of you and you setting expectations with them, is important to a successful project that leaves everybody feeling like it had a good outcome. Okay, so in the interest of time, we have 2 minutes left. And I wanted to address a comment, and I think this might be a comment for Helen. Someone asked, given the importance Brenda did of involving consumers early in this process and in all stages, why isn't there a consumer on this panel? And I think it's a fair question. You're just on mute, Helen. Oh, you're still on mute, Helen.
Sorry, got it. I'm more than happy to, it is a great question, more than happy to answer it. Look, I think as much as we would love to do everything and cover everything, it's very, very difficult sometimes when you have 1 hour and you're pulling, we have 13 partners at HTQ. You're trying to pull resources from, when you're asking people, I mean, we reflected on this already about the imposition on consumers in terms of their time. And the same obviously goes through all the people who are on the panel today, have day jobs. And this is also drawing on their limited time and resources as well. CCI is something that we're very committed to at HTQ, hence our microgrants program, which enables our partners to actually pay consumers for their time. And obviously the CCI framework that we've also invested heavily in. So I absolutely take Bridget's feedback on board, and it's absolutely something, you know, when we look at the design of our webinars going forward, finding those opportunities to include consumers or lay people generally, you know, because obviously we cover lots of different topics. CCI is just one of very many that we include. So it's absolutely something I think that we will definitely consider as part of any future offerings.
Thanks, Helen. And I think that leads us to time.
That is wonderful. Well, I didn't anticipate having the last word, but but I want to thank you all. As I mentioned, you know, sometimes when you log on to a webinar, you don't really think about the level of work and commitment and generosity and goodwill that goes into pulling these things together. So I'm hugely appreciative to our panel for not just turning up today for the hour and sharing their knowledge and experiences with us, but the weeks and weeks and weeks prior to this in terms of, you know, pulling all of this together. So clearly, as we've seen from the feedback, huge amount of interest in this, and obviously a fantastic showcase of the work that's happening in terms of engaging with consumers in a really genuine and meaningful way. So I hope everybody online enjoyed it too. As I mentioned earlier, we will have all of the presenters' slides available online on our website next week so that you can view at your leisure. We'll also put links to our CCI microgrants program with the presentation and a link to the CCI framework. And there'll also be a recording. So thank you all for your time today.